Today, let's know about Florence Nightingale. Florence Nightingale was born in Florence, Italy on the 12th of May 1820. Her father was a wealthy landowner. She was brought up in England. At the time when Florence was born, many girls did not receive any type of education, but Florence was very lucky because her father believed that all women should receive an education. As Florence grew up, she developed an interest in helping others. She told her parents that she wanted to become a nurse. At first, her parents refused to allow her to become a nurse because at that time it was not thought to be a noble profession for a well-educated woman. But Florence did not give up, and eventually in 1851 her father gave his permission and Florence went to Germany to train herself as a nurse. In 1850, Florence Nightingale was asked to go to Turkey to serve the British soldiers wounded in the Crimean War. She traveled to the hospital where the wounded and ill soldiers were admitted. Florence found the hospital's condition to be in a very poor state, so she with her nurse friends changed this condition. They set up a kitchen first and fed the wounded with their own hands. They dug latrines for sanitation and asked for help from the wives that they wounded. They were then able to take proper for the ill and the wounded, and the death rate among the soldiers dropped. Florence was very dedicated to her job. She would often visit the soldiers at night when everyone was asleep just to make sure they were all right. She was then referred to as the lady with the lamp because of the lamp she always carried when she visited the ward at night. Now let's talk about the myths and reality of Florence Nightingale. She invented modern nursing. Myth: Florence Nightingale single and often created modern nursing. Reality: while she played a major role in revolutionizing nursing, there were already trained nurses and medical practices before her. However, she significantly improved hospital sanitation, record typing, and nurse training. 2. She worked alone in the Crimean War. Myth: Nightingale was the only nurse improving conditions for soldiers. Reality: she led a team of about 38 nurses and worked alongside others like Mary Seacole, who also made a significant impact on war medicine. 3. She was loved by everyone. Myth: she was universally admired and respected. Reality: while she was a hero to many, some doctors and officials resented her influence and reforms. Even some nurses found her strict discipline difficult to work with. 4. She carried a lantern everywhere. Myth: she always carried a lamp while caring for patients, hence the lady with the lamp. Reality: while she did check on patients at night with a lamp, the image was popularized by poetry and media. The real lamp was likely a Turkish-style oil lamp, not the classic hurricane lantern often depicted. 5. She was only a nurse. Myth: her entire life was dedicated to bedside nursing. Reality: after the Crimean War, she focused more on public health, hospital design, and statistical analysis. She was one of the first to use data visualization like pie charts to influence government policies. 6. She was always sickly and weak. Myth: she was constantly bedridden and frail for most of her life. Reality: while she did suffer from illnesses later in life, possibly brucellosis or chronic fatigue, she was extremely active and worked tirelessly to improve healthcare for decades.